Thank you, Mr. Speaker. I think everyone on the floor knows that this bill is important for how many times nurse practitioner was said. Colleagues, SB 128 is an important bill that directs the Oregon Board of Medical Imaging to issue permit to supervise fluoroscopy to qualified advanced practice registered nurses. It authorizes nurse practitioners subject to the rule of both the Board of Medical Imaging and the Board of Nursing to utilize the services and expertise of the medical imaging licensee in the performance of procedures within the scope of the nurse practitioner's practice and license. The need for this legislation goes back 3 years. Oregon's advanced practice registered nurses, including myself, are regulated by the Oregon State Board of Nursing, which in February 2016 approved much-needed modernization amendments to the rules governing the certified registered nurse anesthetist scope of practice. The amendments brought the rules into conformity with evolving practice, including by acknowledging that the advanced practice registered nurse, which I will say APRNs moving forward, our scope of practice includes using technologies like fluoroscopy for diagnosis, care delivery, or improvement of client safety or comfort. Fluoroscopy is a medical imaging technique that uses an X-ray beam to create a real-time image of a body part. APRNs use fluoroscopy primarily during the provision of interventional pain management services for the purpose of localizing needle placement. APRNs using fluoroscopy do not operate the fluoroscopic equipment. Rather, they work with radiologic technologist colleagues who operate the equipment. Unexpectedly, Oregon's Radiation Protection Services expressed concern regarding whether APRN rules adopted by the OSBN complied with requirements about who could supervise radiologic technologists. Also unexpectedly, the Oregon Board of Medical Imaging expressed concern regarding who could supervise operators of medical imaging equipment. The stakeholders thus embarked on a multi-year effort to collaboratively address the concerns so that properly educated and trained nurse practitioners can use fluoroscopy within their scope of practice for the benefit of Oregonians. Senate Bill 128 corrects this long-standing barrier to the performance of some procedures requiring fluoroscopy, including pain management and orthopedic procedures. This procedure enables more providers to offer treatment alternatives that reduce the need for opioid utilization and adds a professional tool to help combat our current epidemic. Just as SB 128 does not involve a new skill for APRNs, SB 128 is not a new statutory concept. Rather, it is modeled after the existing statute governing physician assistant practice of fluoroscopy, which authorizes physician assistants to actually operate fluoroscopic equipment. Again, APRNs will not be operating the fluoroscopic equipment. Rather, they will interact with their radiologic technician colleagues who will be operating the equipment. Enabling Oregon APRNs to work with radiologic technologists to use fluoroscopic imaging for the benefit of patients will ensure that APRNs can practice to the fullest extent of their scope, training, and competencies. This is consistent with Oregon's role as a national leader in healthcare. Ensuring that APRNs can practice to the fullest extent of their scope is wholly consistent with the healthcare reform initiatives that urge the removal of barriers that hinder nurses from providing patient care to the full extent of their education and training. More fundamentally, passage of SB 128 will enable Oregon APRNs to continue providing Oregonians throughout the state with access to high-quality and cost-effective healthcare services. The collaboratively developed legislation before you, thus, is good policy in all respects. We must do all we can to ensure Oregonians have access to the care they need. Passage of Senate Bill 128 will strengthen the network of qualified APRN providers who are trained and available to provide that care. I urge you to support this bill so that Oregon APRNs can use fluoroscopy as a tool within their scope of practice to provide necessary, high-quality, cost-effective healthcare services to Oregonians throughout the state, particularly in rural areas of Oregon. Thank you.
Thank you, Representative Prusak. Is there further discussion?